Okay, welcome back, folks. Continuing our discussion on the FY 27 budget recommendations, and we are now moving to Dale, Department of Disabilities, Aging and Independent Living.
Right on. Okay.
And Dan and Todd. This is Dan and Todd's area.
Turn right over to Todd. No. Okay, so thank you so much. As you've heard, a lot of the work that we've been thinking about around how we do our budget is directly tied to Age Strong Vermont and kind of our long-term plans on how we make Vermont the best place to go old. So looking at the budget, a couple things have come up that one of the things is the elder care clinicians looking at mental health services for older Vermonters. There was a $349,763 cut in the budget, which zeroes that out. So, trying to figure out how we can continue that program because as, we see this population needing more of these preventative services, we just felt that that's something we would propose to the committee as a potential something that we would fund. You heard that you heard in the presentation yesterday, the services are needed. They are basically piggybacked into other designated agencies that are already providing mental health services. So these are kind of like giving them the funds they need to provide services to older Vermonters, kind of over and above what they're doing with the rest of the population. And these elder care clinicians are working with case management, and the idea is that they're kind of around the state. So these don't pay for direct positions; they pay for existing positions at our DAs to just help offset those costs of providing mental health services to older Vermonters. You want to have any questions on?
How many people are served? I don't remember if
I'll have to pull that up, but I don't know if I have that. I have a bunch of tabs open. I might have that one open. How many people were served?
I'm presuming that when Dale was asked why this was being cut,
Underutilization.
that it was underutilization.
And so, always an interest on how reporting is done. Because these are not individuals that are directly employed, the funding comes through the agencies providing that the information to Dale. They probably information to Dale through the designated agencies that they provided these services.
So I'm presuming that they record it in the MMIS, not the HMIS, but the MMIS, Medicaid Management Information System, that the agencies are recording the units of services under this program.
I would have to get clarification on that
Okay.
because I do not know.
So
MMIS.
Yeah,
We'll find out.
if we can find out how many people, how many units of service were provided, so we can
Mhm.
make an informed decision about if we agree with the cut, we know what's happening,
Sure.
what the impact is going to be. And if we, elect to restore it, that, we know what the capacity is.
Sure. So next, we've talked about bringing to the committee home share. This is, as we heard yesterday, really looking at keeping people in their homes. Again, a preventable way to keep people out of assisted living, long-term care, whether it's home and community-based or nursing home care by just keeping them in their homes to have someone in there who can provide support, companionship, help around the house to be able to continue. In the past, they've gotten one-time funding, so this would be a $235,000 reinstatement of the one-time funding that they received that is not in the FY 27 budget. And so this is Northeast Kingdom work. that they've been doing. And so that will be one of the things that we'll be proposing.
Yeah, those two. Oh, sorry. Sorry, Dan.
No worries. Again, home share housing is a big initiative in our age scoring plan.
So do you have sources of funding?
Not yet.
Okay.
I'm hoping.
Prevention funds.
The problem,
Oh, we have tapped the prevention funds.
as you know,
25 months left.
Prevention funds have been tapped out and no one doesn't even know what else we spent from there
yeah,
today.
as you know, the way the budgets are rolled up, there's a lot of line items that some show some pretty substantial increases that are just listed as grants. Looking for a breakdown on what those grants are so we can kind of weigh the where the money is being allocated versus where this committee may decide to allocate the funds. Hopefully I can get that information because I can just see grants and a number.
Well, I think we know how much is appropriated for Choices for Care. I
Correct.
would see home share as a direct correlation to essentially another alternative
Mhm.
to
Absolutely.
housing.
Yeah.
There. And so it's a pretty small number and it's
Small
something,
number.
it's something that I think that we could deduct from Choices for Care
Mhm.
and
Yeah.
call it a day and say that that's where we're
Fantastic.
funding it.
Okay, got that on my list. Thank you. The other thing that we've talked about, Todd and I met with Renee, a deafblind man who came to the State House, and we had a great discussion with him talking about how these interpretive services, his ability to communicate, was cut and about 150,000. So we looked at the reimbursement rate that these individuals are given to provide this service. That's pretty technical. It's actually from someone who is lucky enough to have my sight and my hearing, interesting to communicate with someone who goes through these interpretive sign language in their hands. It's amazing. So, again, quite a small amount to be able to provide services to this population. Todd?
In our meeting with the individual, people who do help out, all you pay $21 an hour. It's part-time, they gotta be trained, and they get no gas reimbursement. He likes to go, I think you in Waterbury, right?
Yeah.
Yes, he does.
And the event, you'd love to go to Bennington. That's like a 6-hour thing, going to the event and everything else. And $21 an hour to find somebody trained is kind of hard in my world.
Mhm. And so one of the things also that I thought was interesting is we do have transportation services for individuals through our E&D, but drawing a blank on the new name. They changed the name. But basically through V-Trans, we do have access to transportation for these individuals, but kind of need someone to talk to the driver. Kind of need someone to, when you get out of the car, to be able to communicate when you go into the store, to tell you, this is one of the things he said, I need someone to tell me what's on the shelf,
Yeah.
what I'm looking for as I go through the store. So, this is one of the things that we all take for granted, that sure, we can get someone to come to their house, give them a ride to the store, but once they're at the store or at an appointment or whatever they got going on, they need someone to communicate on their behalf through this process. So,
And we have a bill. We heard testimony on this bill last year, at the end of last year.
mhm.
And I would still like to get it out of here if possible. But I think it's 143. But this would support what that bill does, which is to essentially establish this program that it wouldn't be cut unless it was cut by an act of the legislature.
So the next thing that we talked about is looking at, sorry, I'm just trying to find something real quick.
Mhm.
This isn't in here. So long-term care ombudsman, she sent me some information last night that I forwarded over to you, and now I'm trouble. I just want to read it so I don't miscommunicate what she sent me. And bear with me 1 second, I'm almost there. Okay, here it is right here. So looking at this long-term care ombudsman, make sure that people who are living in nursing homes, res care, receiving in-home care through our choices for care, that they're being cared for with the money that we're spending for their care. And I asked about private equity, which has come up. These are nursing homes that are owned by investors. Nothing wrong with that. We need to have different levels of care in Vermont and how they're funded. But I asked her, what percentage of private equity corporations, so these are nursing homes, that, are you seeing that you're having to provide your long-term care to go in there? And it's 40% of the complaints in FY '25 came from 7 facilities in Vermont that are all owned by private equity. So 40% of all her claims are from 7 facilities. So,
What is the percent of, like, what does that 7 facilities, what percentage of all the facilities is that?
oh, well, I mean, there are hundreds.
Right? Yeah, so it's
a very small amount. Well, these are big. These are not like small nursing homes, right?
Yeah.
And I can dig down a little deeper into that.
Was she giving figures just for nursing homes, which would be much
Correct.
smaller?
Or 7% of their actions are
40% of their actions
at 7 locations.
of just the nursing homes are all because nursing homes is like what, 30 something?
30 something units. Yeah.
So it's probably twice the
Oh, yeah.
number of complaints for their.
Correct. Because they are complaint driven.
Yeah.
And so for her to be able to provide these services, she's looking for 230, sorry, got the wrong line item there. 275 was what we talked about. In terms of funding, we should look to the places where the complaints are coming from to help fund the positions she needs to be able to address these complaints and help these individuals. Because ultimately, our goal is to make sure people receive the care that they need to be able to live in our state. So next on our list,
So how much is that? How much are you recommending?
275.
And that seemed to be more akin to a COLA.
That could be true.
You confirm or deny?
Nope. Preliminary information I'm providing right now, so I will be able to.
How much would it take for them to, I remember her saying
Mhm.
they were be losing a staff person.
Correct.
How much would it take to maintain the staff person?
So looking at when you think about our funding ask and if it's being a COLA, these agencies will have to pay their employees in order to keep them anyways. So we don't give them the money. It's got to come from somewhere. They don't print money. So will they reduce staff? In this case, sounds like they'll reduce staff. But this isn't the only one that could possibly reduce staffing based on the amount of funds that they have and to be able to retain the staff that they have to be able to do the work. So just throwing that out there, I will find out what it costs for one employee.
Not what it costs for one employee, but what would it cost? What is it going to take in order for them to retain that one employee?
Mhm.
So
Right.
it's not going to be the total cost of it.
Correct. Yep.
So Because I don't think we want to see this resource reduced. But, I'm also committed to, be treating
Yep,
everybody equitably, which in
Not a
this
problem.
case this year means no.
okay. Not a problem. My job is to look at the overall picture at the Dale budget and come back with the recommendations.
No, I appreciate that. I'm just
To the committee.
trying to
Yeah,
be
no, I hear you. I hear you.
clear. I know you
Yep.
hear it and you don't like it. I get it. I smile. I know the fake smile. I know. Stand long enough.
Okay, so the next one I have, is Meals on Wheels, and we heard that they are, being, even if you just look at the rate study, from FY '24, and look at the inflationary pressures that they're seeing in order to deliver Meals on Wheels at the $1 million, that's over 1.4 million. They were looking for 1 million just to try to make ends meet, reduce some of the cost drivers that they're seeing in order to be able to provide this service. Currently, it's about $7 million, based on the rate study that they are having to fundraise. And so we had talked about including 1 million, which is $1 a meal, to provide them with more finances to be able to make sure that reduce their waiting lists if they develop, and to deal with the increased number of people coming through the door. So,
Is that 1 million gross or net?
well, so that's a good question. We could do either one. And I'll tell you why the concern is the investment money. So, there's always some concern that if we were to put more into investment, and down the road, if that changes, we're going to have to figure out where it's going to come from, or we're going to have even more reductions.
Mhm.
So, I guess I would leave that up to some, depends on how much money I can find otherwise, to be able to fill it.
Yeah.
If we have to go with investment, then yeah, that's considerable less money, to be able to, if we can use general fund, that's a lot more stable in the long run.
One of the things that I have asked for additional information on is the allocation of the million, and then the it's little almost 2.5 million now.
Mhm.
With the global commitment, of how much of that money has gotten out to the meal sites directly.
We asked yesterday.
Yeah, right. And so I think,
US.
I think that they are working
So
on
I
that.
think they are. And yeah.
Because it really, I think it's important to understand that things like the nutritionist and dietitians and all that, those are all things that have been previously covered under Older Americans Act. And so I'm trying to make sure that, absent, something relatively small, that that money has gotten out to food providers, to meal sites. And so hopefully between Dale and whatever the new name of AAA's is, that we can get that information.
Yep.
By Tuesday.
Yeah, like I said, I'm meeting with Commissioner on Monday. Todd and I are, so we can have some information to bring back to the committee. Yep.
Do we think that additional but brief language, very much setting very clearly our intent with this money, should be laid out?
I feel like it needs language in the language
Yeah.
section.
Definitely that it must directly be provided to the meal providers rather than.
Yeah,
Okay.
yeah. I mean, unless we can see some sort of, I guess, what I would call reasonable overhead that
Mhm.
I can't imagine that. I'm just trying to figure it out, myself, to be honest, because it's all the same hundreds of meal providers out there, however many there are. There's quite a chunk of them out there. And it's, the money was all going out to the same people that the AAA's already put the money out to under Older Americans Act. And so it didn't seem like it needed to be like some separate thing unless Dale was imposing some separate requirements, which I don't know, maybe they did. Yeah, it'd just be helpful before we decide whether we're gonna allocate more money to make sure that the money that we put out there already is getting to the intended recipients.
Fair enough. We can work on that. All right, the last one that we have is looking at back to my prevention, making sure that the home and community-based providers through ACCS and ERC are supported.
Mhm.
And so that goes right into your list of COLA. 1%, 84,000 for ACCS and 85,000 for each 1% in the ERC.
So you're saying you're not recommending any COLA for any of the other providers? only
Love to.
those?
But
You're highlighting those as extraordinary need?
I'm just seeing, I think, you're asking us to make choices, and these are the lowest cost care for individuals in need of these services before they end up in the most expensive care. By the way, I got an amount yesterday from the cost of Medicaid nursing home. Just to put that out there, I could find it because so many emails and texts flying around. I'm trying to capture all this information. But it was like 300. So it's over $300 a day for a Medicaid nursing home. So
Oh, yeah.
Anyway-
Unless you're in Bennington and it's 600.
right, any way that we can provide the supports for our enhanced residential care and residential care. Here it is right here. Daily nursing home Medicaid cost is $389.98 as of January 1st. So any way we can support these home and community-based res care, we're going to be better off.
I'm just wondering, I know that there's been sort of some new ones come on, some ones had closed. And I'm just wondering if there's any thought being given to sort of supporting some development funds to increase the number of residential care homes.
I wonder if that's something that will come up through our health transformation grant. I know that they're really working on providing training and recruitment tech, for staff.
Mhm.
And so is there a possibility that we could start, seeing some work investments go into opening some more? But just to put this in perspective, if a nursing home is $389, it's 430 days worth of one individual in a nursing home to give a 1% increase to ACCS and ERC. 436 days in a nursing home for one individual will cover all the individuals, all of the providers
For 1%,
for 1%,
each one.
each 1%.
Yeah.
So if we could keep one person out of a nursing home for a year and a half by giving them 1%, we win. So
Can you explain what the numbers in the budget description / other columns are referring to the services grants?
are you looking at the rate study that came out
Is it gonna-
when I sent?
I'm looking at the budget sheet.
Budget sheet,
Oh, the one that's in there?
yeah.
Oh, yeah, I'm just starting working on that. I haven't put much in there. Don't read those.
Consider it not read.
Thank you. Actually, some of that is last year. So I'm just trying to get some template in there that I can go back and work on the numbers. So yeah, that document is not really ready for prime time for us.
And I will remind folks over on the left-hand side, and I included it with your email, a link to the document that we sent last year. So you get a sense of
Mhm.
what we're looking for.
Yeah,
So
So
what else
those-
do you have, Dan?
that's it.
And so are you in agreement with the caseload increases in Dale Developmental Services, in Choices for Care? Is there any nursing home rate increases in here?
I don't have an answer for you right now on.
Okay.
Could you repeat what you just said?
Are you
Just trying to be helpful.
are you in agreement? Because it's,
Mhm.
you kind of glossed over a little bit,
Mhm.
the two big increases in the Dale budget, which is caseload increases
Yeah.
in Choices for Care and caseload increases in developmental services.
Okay, yeah.
And so,
I mean,
are you generally in agreement with those things?
yeah, I mean, they're looking at how many more people are coming into needing these different levels of care. I don't really have, I mean, I could ask them how many individuals that is, if that would be helpful, but
I think that would be helpful.
Yeah,
It's not,
okay.
I think it should be in their data
Yeah.
there. The other thing is, not only the number of I'm pretty sure I saw that in their description of their caseload increase. Is there a budgeted increase for, rate increases for nursing facilities? I don't think it's a rebasing year, but,
Mhm.
I don't know that, but, I just am
yeah,
wanting to know that.
you got it.
Okay. So to summarize, what I heard you say is that priorities for the team are the deaf-blind supports, the elder care clinicians,
Correct?
the Meals on Wheels,
Yeah,
a inflationary increase of 1% or more for
Mhm.
ERC and ACCS.
Yep.
An increase for the long-term care ombudsman.
yes.
Did I miss anything?
Nope, deafblind,
Pardon?
deafblind.
I said that first.
Okay, sorry.
Yeah,
Yeah, I'm
Yeah.
just saw that on my list. Yep,
Yeah.
that's it.
okay. And so far, you've not identified any sources of funds for any of these.
There is a grant that I found that I'm trying to get some more information on.
Okay.
It wasn't as much as I expected it would be.
Okay.
So, I think you just have to look at, the caseload increases and, how those, accurately affect, or accurately reflect, actual increases. They're either gonna, at the end of the year, they're either gonna have estimated high or low.
Yeah.
And there will either be money there or they will be here in the BAA.
And typically, I have to say, other than EFR, I haven't really been here for a caseload increase,
Mm-hmm.
either on the DS side or on the
Yeah.
Justice for Care side. So, okay, this seems like a good place to start. You to stop. Yeah, here we go. We will pick up with additional discussion tomorrow after floor. Like I mentioned earlier, they're expecting our recommendations early next week, so we need to finalize these by Tuesday, I'm hoping. That means the language part too. Yeah. Has everybody read the language pieces for their pieces of the budget?
Nothing.
Nothing that you saw, okay. Everybody's checked. Okay. All right, so we'll see you back here after Florida.